Hi everybody, I'm here in my pajamas and I've got a nice latte here. Anyway, this is not a video about coffee, but I thought I'd make a video about schizophrenia because some people might not know what it is. And so I thought I'd talk a little bit about that. Basically, in case you didn't know, I have schizophrenia and I'm taking medication to sort of alleviate the symptoms of the disease. I started having problems when I was like 15 years old, or actually 15 and a half, and then I finally got help when I was like 16. Well, I saw like a therapist a little bit before that, and then I was hospitalized for the first time when I was 16. And so what schizophrenia is, it's classified as a mental illness, and basically they don't know exactly what causes it, and they don't exactly know the mechanisms, like what happens in the brain. They have studied people and found that there is some evidence that there is less brain tissue in the prefrontal cortex of people with schizophrenia, but that's not for sure. And that's like the fore part of your brain, kind of. Not your forehead, but anyway, the fore part of your brain. And that kind of area deals with things like decision making and stuff like that, and thinking. And there is some evidence that it has to do with a neurotransmitter called dopamine, but they're not sure about that either. But basically what the symptoms are, it's kind of classified as a thought/mood disorder, or just thought disorder. Some people don't have mood symptoms. Like I think bipolar disorder, while it does have some thought disorder symptoms, it's largely classified as a mood disorder, like depression. Bipolar disorder is when you essentially, I mean, there's a lot of components to it, but it's essentially when you have a really high mood swing up into feeling really good and manic, and then you go down to feeling really low and depressed. And depression then is just feeling depressed without the manic part. And so schizophrenia is, it can have a mood component, but it doesn't always have to. But basically, it is kind of a thought disorder, I guess. Basically, people lose, basically, I think I would say people lose some kind of contact with reality. It's not that they have a split mind, like in dissociative identity disorder, people actually become like another personality, and that's like, if you've seen the movie Sybil or read the book, that's kind of what that's about. But with schizophrenia, like most people have hallucinations, which are, they can be visual or auditory or olfactory even. So visual hallucinations, they see things that aren't really there, or auditory hallucinations, they hear things that aren't there. And like olfactory hallucinations, or people smell things, or maybe they feel things that aren't there. Olfactory is smelling things, but I don't know what, when you feel things that aren't there, I'm not sure what that's called. But basically, and then another symptom of schizophrenia is something that I have experience with, which is delusions, which are having strange or bizarre thoughts, which don't really coincide with reality. So, like, I would think really weird things, like the city was being, like, experimented on with nuclear or with kind of like chemical weapons or something like that, which there's no basis in reality. It's just kind of paranoid thinking. And I'd have I had so many delusional thoughts. It's like just one after the other, thinking that a piece of hair on the floor is actually a microphone and I'm being under surveillance by somebody or something like that. That kind of weird, paranoid kind of thinking. But it can take any, shape or form. And some other symptoms of schizophrenia are it's 12:45. I don't know if you heard that. It's my other computer talking. No, I'm not delusional. I'm kidding. Let's see, some other... There are things called positive symptoms, and then there are negative symptoms. Basically, the positive symptoms are things that are extra that normal people wouldn't have, like the hallucinations, the delusions, things like that. The negative symptoms are kind of like someone lacking something that normal people would have. So, a lot of times people with schizophrenia withdraw from society or from their friends or relatives, or they become elusive, and so sometimes people become catatonic. There's a subtype of catatonic schizophrenia, and basically they shut themselves away from everybody, and that's kind of a negative symptom. And another symptom is disorganized thinking, where a lot of times if you read something that's written by someone who has schizophrenia and they're actively psychotic at the time, their writing is what's called a word salad, where it's just random words placed throughout the text, and it really makes no sense to someone who is sane. And probably another schizophrenic person could not read another schizophrenic person's writing, because it just is kind of jumbled and garbled words, and they mean something. I would argue that they mean something to the schizophrenic person at the time that they're writing them, but then they don't really make any sense. So, and that's kind of the thinking is kind of doesn't make a lot of sense, but I think that for schizophrenic people, things do have meaning, but it kind of gets mixed up in their head, and so, things are given meaning that have no meaning, like a pencil lying on a table suddenly becomes a symbol for the next coming of Christ or something like that. So it's that kind of thing. So, and there's, I don't know, other symptoms, stuff along those lines. I don't really have, I have the DSM around here somewhere, but I'm not going to go through those list of symptoms, but you can look it up online. If you look up the DSM-4 which is text revision, that's the diagnostic manual that's used to classify them, but there's a lot of problems with that too, so there's a lot of controversy surrounding that. So anyway, basically, people with, let's see what time I'm at here. Oh, I'm running out of time. So I guess I'll make another video because I'm running out of time, but basically those are kind of the symptoms of schizophrenia, and yeah, so I guess that's it. Bye.